It is time for Health Beat. You don't necessarily have to isolate after a COVID diagnosis anymore. The California Department of Public Health has updated the guidelines. So here's how things work now. If you test positive and you're asymptomatic, you can still go to work or school. If you test positive with symptoms, you come out of isolation after your symptoms start getting better and you haven't had a fever for 24 hours. That's without any medicine. No matter what, if you do get a positive COVID-19 test, you need to wear a mask for 10 full days or until you get two negatives 24 hours apart. UC Davis Children's Hospital Dr. Dean Blumberg says the landscape of COVID is changing, so the guidelines were updated to reflect that.
Because there's widespread immunity now from vaccination and/or infection, there's much lower risk of serious disease. Plus, there's vaccines available and treatment. And so that's why these guidelines are being relaxed, because we know the impact of the isolation has really been profound, especially in children in school. There's been a lot of learning loss.
So Dr. Blumberg says at-home antigen tests are better when it comes to determining how long you have to stay home. That's because the PCR tests are extremely sensitive and you could test positive for weeks or even months. Those are those tests that you get at CVS or maybe Walgreens. So something you might not know is your expired COVID test might actually still be good for use. You can scan a QR code on the box to see if the manufacturer has extended the expiration date. Also, you want to make sure that you check with your child's school district on these guidelines because they can choose whether to adhere to them or not.